welcome to The Next Word. I'm your host, Chris Warnke, and today we have a very special guest in Senator Ben Cardin of Maryland, who's going to talk a lot about his efforts in the Senate on helping the underbanked and the underserved small businesses in this country, certainly during the time of COVID. Senator, it's wonderful to have you, and I can't thank you enough. And let's talk about this, because I know you really are leading the efforts with Senator Booker in terms of how we're helping out minority businesses who have really made such strides over the last decade, but now we're facing a lot of issues and challenges. So Senator, thank you again.
Well, it's very good to be with you. Thank you very much, and thanks for what you do. And thanks for bringing this up. Look, COVID-19 has impacted everyone. There's no one in our community that hasn't been impacted by COVID-19. It's unprecedented, and its impact on our economy has been devastating. But if you're vulnerable before COVID-19, you're even more at risk. So we find that the underserved community was more vulnerable to the impact of COVID-19. From a business point of view, they didn't have the capital, they didn't have the resiliency that larger companies or more established companies had that have been traditionally helped. And they found themselves in a very difficult position. When we developed the Paycheck Protection Program, PPP, it depended upon a loan given out by a commercial institution. So if you were underserved and underbanked, you were particularly vulnerable. So we found that minority communities, small businesses were very much impacted. Women-owned small businesses, veteran-owned small businesses in rural communities, smaller of the small businesses. All those were at a disadvantage. Everyone's at a disadvantage by COVID-19, but these businesses were particularly hard hit. So we knew we had to do something special to help them. So when the CARES Act was created, I offered an amendment to it, which was adopted, that required the Small Business Administration and the Treasury to concentrate on the underserved communities. On the first round of PPP funding, it was $350 billion, we found that there was not as much funds going to the underserved and underbanked community as we would have hoped. So we made a mid-course adjustment, and quite frankly, on the second round, they did a better job, but not good enough. So Senator Booker and I have introduced legislation that will help establish the infrastructure in the underserved and underbanked community so they can not only get help with COVID-19 related challenges, but that we have going forward the type of infrastructure in our community that allows the underserved, traditionally underserved community to get the financial help and capital support that they need in order to have a fair chance.
Oh, that's great. And now, of course, we're looking at another stimulus package at one point, right? Next month?
Well, HEROES has already passed the United States House
right.
of Representatives.
Right.
Bill. So it is a bill that contains significant help for state and local government, a lot of help for programs that are desperately needed because of COVID-19, such as services for mental health and addiction, services for transportation, services to pre-K through college for students and the institutions themselves, and also additional help on the economic front.
Right. And I know over the last course of 2 months, Senator, you've been working and you've been having regular calls with local leaders, county officials, state leaders. And what are you finding out? I mean, I'm sure they're all saying pretty much the same thing, but.
Well, you're right. We're having lots of calls.
Having lots of calls.
I am here in DC because we're having votes in the United States Senate. But almost all of my work is done by the internet and by telecommunicating. So yes, we've had numerous conference calls or Zooms or whatever media is available in order to get information out to state and local officials, to get information out to our academic leaders, to get information out to our healthcare community, to our small business community. So yes, we've been doing regular meetings. Normally I would be doing regular visits. I would be out in Montgomery County, small businesses, or going to the local hospitals, or going to Rockville to meet with the county council. But instead we have to do this now through teleconferencing.
And what kind of feedback are you, I mean, they're all pretty much saying the same, look, we're losing revenue, obviously. You know, what are we gonna, you know,
There are some common themes. First, clearly everyone's worried about the public health and want everybody to stay safe.
right,
We want to get past this virus. It's a deadly virus. It is cruel, and we don't know enough about it, and we don't have the vaccine or therapeutics that we need. So social distancing and protecting public health is still our number one priority. And I hear that over and over again from all the stakeholders in our community. Secondly, we're hearing that for state and local, their budgets are just decimated. Their revenue are just so far off. If they rely on income tax revenues with so many people unemployed, that's easy to understand how their revenues are off. But recognize that state and local governments get a lot of their revenues through the fact that people shop at stores, that people, that's the sales tax revenue, or from the hospitality industry, the hotel taxes, the car rental fees, the parking fees, all that have been so much affected by COVID-19. So in order for them to be able to continue essential services, and we're talking about essential services such as fire and police and emergency rescue, our schools, they need help from the federal government to make up for their revenue loss. And without that, it will be almost impossible for them to be able to carry out their essential services.
right, absolutely. And you have an airport right in your, obviously in your state, the Baltimore, Washington, airport. What have you been seeing there? I mean, certainly, the air traffic has, changed, all the services related to the airport.
Well, on the CARES Act, we provided substantial help to small businesses. We've talked a little bit about that. We provided some help for larger businesses through loans. And then we provided a sectorial help for the airline industry, recognizing that they were just going to be out of business for a while. We had to make sure that they're available because air transport is critically important for our economy and for our way of life. I did talk to our airport officials in Maryland. They tell me that you could walk through the airport and see no one, that the number of people flying are virtually zero. Planes are flying with one or two passengers. It has been almost, it's eerie. It's empty. So it's not only affecting the airlines, but all those businesses that are related to the airline industry have seen their revenues go down to virtually zero.
Really? Oh, that's really good. I know there was going to be a hearing, I think today, in the Environment and Public Works Committee, by the way, on infrastructure, and that's going to be a huge issue too, I think, moving forward, as you well know. And the water infrastructure bill, and we just saw some devastation up in Michigan with the dams breaking, but there was going to be a hearing. And what's your thought on the water bill and how's that going to move, and what's the support?
A great question, and thanks for asking that. So let's put this in context. Our immediate problem is triage from COVID-19. We're triaging in regards to what we call a Marshall Plan on healthcare, to make sure we have all the resources we need to keep people safe, for the testing, for the protective equipment. We do have challenges today. It's more of a supply chain issue than it is a financial issue, but we want to make sure the resources are there to deal with this pandemic. Secondly, we want to get our economy back on track as quickly as possible. So therefore, we beefed up the unemployment insurance system. We have checks going out to all taxpayers in this country. We've had direct relief for small businesses and help for all businesses. So that was our second level of tactic, get our economy back on track. But we recognize with so many people unemployed, we're at levels that look like the Great Depression. We're going to need to do something to get people back to work. And we know that building infrastructure is great for job growth. So that whether it's a road, a bridge, a transit system, whether it is the pipes that deliver clean drinking water to us, for our wastewater, or whether it is connectivity for our schools so that all students have access to the internet and speed broadband and have the technology to have it delivered to them personally. All that will create jobs, but also make our country stronger when we come out of that infrastructure development stage. We know that we need a more modern transportation system. We know that we need a more modern water system in this country. And we know that we need to have connectivity for every household in this country for families to be able to deal with their educational needs for their children, as well as their commerce needs. Life's going to change after COVID-19, and connectivity is going to become more important. So if we concentrate on infrastructure, if we get that done, we can create jobs. We know how many people are unemployed today, and we can also help our economy grow for the future.
Well, I know we have such an aging water sewer system too in this country, and certainly probably in the state of Maryland as well. And so that would be a tremendous boost to our economy.
And you mentioned WRDA. WRDA is the Water Resources Development Act. It deals with water infrastructure. It's a subcommittee that I am the ranking Democrat on. We just recently passed a Water Resources Development Act unanimously by our committee. So there's broad bipartisan support for it.
Right.
The challenges on water projects is that you don't really see them until you see the water leaking our streets.
Right.
Remember a few years back in Montgomery County where River Road became a river. So it's devastating, the cost when we don't fix and modernize our water infrastructure. And it's extremely wasteful. We waste so much water that leaks through our. We have taken for granted safe drinking water, but that's at our peril, taking it for granted. We want to make sure that when you turn that tap on, that you have safe drinking water and clean water, and we have to invest to make sure that's a reality.
Oh, absolutely. And you touched upon, connectivity, and especially for students. And you do represent a lot of rural areas, Senator, in the state of Maryland, which people don't really, understand or appreciate. So I'm happy to hear that, because a lot of these students don't have that, nor do they have it in the backyard of Baltimore City, for that matter.
You'd be surprised to learn that every one of our 24 subdivisions have problems with connectivity. Every single one.
Really?
So there's rural parts in all of our counties. In Baltimore City, they have other issues with connectivity as far as getting reliable service. A lot depends on the service provider providing the last mile of connection. And if you don't have density or you don't have people who can afford the internet service, the private provider is not providing that last mile. So we have to do more to make that a reality.
Yeah, that would be great. I had Senator Van Hollen on about a week ago, and we talked about having more federal workers telecommute. Of course, he has an initiative on that, and I just wonder what your thoughts are, since a lot of your federal workers, are in the state, and certainly Montgomery County. And
so before COVID-19, I had, along with Senator Van Hollen and our delegation, contacted the federal workforce people to say, your directions are not consistent. We should always be promoting telecommuting, telework, because it's more efficient. It takes cars off the road. One of the plus things about COVID-19 is that a commute that normally takes me 2 hours and 15 minutes from Baltimore to Washington now only takes me an hour, because people are on the roads. We have many people on the roads, and many of these people don't need to be on the road. As we found through COVID-19, we do a lot of work through the internet and through working at home. So we should have encouraged well before now, as many companies have, telework and telecommuting, so that where it's possible, people can work at home, they're more comfortable, it's more efficient, and they can get the job done. Now with COVID-19, it's a necessity. So yes, I have joined with my colleagues in requesting that the federal government be extremely aggressive in setting up ways in which our workers can work from home. They prefer to do that, and they can be more efficient.
And so speaking of working from home, I mean, the House, as you know, has gone into remote voting. How do you feel about that in the Senate, Senator?
I think it makes sense. Look, I think we should be together when we can safely, because the interaction is important for legislating and for compromise and for how you get work done in the United States Senate. But voting, quite frankly, is usually, you're not people know how they're voting when they come to the floor. Why not do it remotely? I think that's a safe thing that can be done very efficiently and without jeopardizing people's public health. In the Senate, we have 100 senators. So it's a challenge every time we have a vote. We have 4 votes scheduled today, and we spaced them out over a couple hours each. That's an inefficiency. We could have done that through remote voting in a safe, secure manner. I think we should.
So today you have a vote. You have 4 votes.
Correct.
That you're going to be voting. So you had to space them out, what, every hour, 2 hours? Or, I mean, how's that?
Normally a vote is 15 minutes, which
Right,
usually
right.
20 minutes. We're now doing 45 minutes on votes, and we're encouraging no more than a few on the floor at any one time. But, we have staff on the floor.
Right.
Just to get from my office to the floor, and I go through the outside because it's safer to me to be outdoors than going
Right.
through. But you're still having contact, more contact than you need. We try to do it in a safe manner. I wear a mask. Just about everyone's wearing masks.
Right.
And we try not to get within 6 feet of anyone else.
Right.
But as you know, the more times you chance this, the greater the risk factors.
Right. So, Senator, we're going to take a short break, and we will be right back. Thank you. Welcome back. You're watching The Next Word. I'm your host, Chris Warnke. And today we have Senator Ben Cardin of Maryland, who actually serves on the Senate Small Business Committee, the Senate Finance Committee, the Senate Environment and Public Works, and the Senate Foreign Relations Committee. Has much to do, and we're glad to have him. Thank you, Senator, for all the work you do on behalf of Maryland, but certainly the country. So let's start here. Let's get back and talk a little bit about going more regional and talking about back to the state of Maryland and Chesapeake Bay. Tell us what's going on with some of the work that's being discussed in terms of the Clean Water Act. And since you serve on the Environment Committee, you've been tracking this very, very closely.
Well, Chris, it's good to be with you, as I said earlier,
Thank
in
you.
opportunity. And so the Chesapeake Bay, of course, is a national treasure. It's been declared that by successive administrations. It's iconic to Maryland. It's part of our way of life. And we've had a long tradition of bipartisan support. I would say it was nonpartisan support for cleaning up the Chesapeake Bay, recognizing it's a challenge because so many people want to live in the Chesapeake Bay watershed. The good news from the federal government is that the Senate has passed legislation that would reauthorize the federal participation in the Chesapeake Bay program and authorizing it at a higher level than the current authorization. So it's actually an increase of about $15 million. The other good news is that the appropriators, through the appropriation process, and I acknowledge Senator Van Hollen serves on the Appropriations Committee, we were able to get an extra $12 million in the Appropriations Committee. So there's been bipartisan support in the Congress of the United States. But the challenges are great. We have a commitment to clean up the Bay at certain levels by the year 2025. And that date is closely arriving, and we are not on target to meet our goals. That's one of the reasons why the Attorney General from Maryland, Brian Fosh, and the Attorney General from Virginia recently filed a notice to sue the federal government to enforce the local plans. This is bottom up. The states develop the plans, but then they have to live up to these plans. And Maryland believes that while Maryland's doing its work, Virginia's doing its work, there are other states that are not, and that the Environmental Protection Agency must enforce the law, which they have not been doing. So we're having this challenge with the Trump administration on enforcing the Clean Water Act and the Chesapeake Bay program. We're going to do everything we can to make sure we protect the Bay. It's challenging. If we didn't do what we're doing now, the Bay would be in much, much worse shape. But it's still a challenged body of water and requires constant attention.
Yeah, but one thing I'll say that I think in the Senate Environment and Public Works Committee, I've been seeing that there's a true bipartisan, I think, effort. So am I correct? I mean, Senator Barrasso, working with Senator Carper and working with you and working with others, I think I'm starting, I feel like you've seen more and more of that, which is very encouraging.
No, I agree with you. I think on the Environment and Public Works Committee, there's been a long tradition of getting legislation done bipartisan. We got the Surface Transportation Act passed unanimously. We got a Water Resources Development Act passed unanimously. I serve as ranking Democrat on the subcommittee for infrastructure. The chairman is Senator Capito of West Virginia. The two of us have worked very, very closely together on so many issues, including, by the way, issues that affect both of our states in the western part of Maryland. So you're correct. The committee has a great reputation of working closely together. Almost all of our legislative work has been near unanimous. That doesn't detract from the point of view that there's differences with this administration's approach on the environment. And at times that will be difficult for us on the committee to do what we want to do because of this administration.
But hopefully the water bill will be moving once you all get back, after next week, the week after, correct?
That's right. We hope to pass that bill very shortly. It passed our committee unanimously. We thought it might come up this week, but that's not the case. So we hope in June, the Senate will pass the Water Resources Development Act.
Right. And one of your other committee, which of course Senate Finance, and you're on the Health Subcommittee. I know a huge effort that you have put over the last several years has been on certainly providing dental care, proper dental care for our younger populations. That's been a concern of yours, and I've seen the statistics in terms of 1 out of every 5 children actually suffer from tooth decay. And I know there's some alarming rates, especially with COVID-19. Parents aren't being able to take their children to the dentist. They may not have dental insurance anymore. God, it's frightening. Can you talk a little bit about maybe next steps?
So it was 12 or 13 years ago, in my first year in the United States Senate, we had a tragedy in our state when DeMonte Driver, 12-year-old from Prince George's County, Maryland, died basically from an untreated tooth decay issue.
Mm-hmm.
His mom tried to get him to a dentist. No dentist would treat him. He had no insurance, did not have coverage, fell through the cracks of Medicaid, and we lost his life. We made a commitment to change the landscape on pediatric dental care. As has been stated by our Surgeon Generals of the United States, oral health, your status of oral health is very much going to impact your general health care status. And most of the dental issues are preventable. Tooth decay is preventable. So it requires regular attention to your teeth through brushing and seeing dentists and getting that type of oral hygiene. Unfortunately, 12 years ago, we looked at how Maryland was doing, and we were near the bottom of the country in the number of children who need regular attention. Now we've reversed that. We're now one of the best in the country. I helped pass legislation that required pediatric dental care under our health care proposals, whether it's the Children's Health Care or under Medicaid or under the Affordable Care Act. Pediatric dental is now a fully covered service. So we have changed the landscape. The situation is much better today, but we still have a way to go on oral health care. Too many adults are not getting the oral health care that they need. We need to change that, and we have to make sure that we continue our effort to make sure every child understands the importance and their parents of oral health.
Right. No, that's terrific, and thank you, because it's a huge issue. It's something that people don't really, dental care is kind of put at the bottom of the rung sometimes, and especially given COVID-19. And now that we are starting to see reopenings in the state of Maryland, what do you think of that? And we saw that certainly this past weekend in Ocean City.
Well, we're going to have to live with COVID-19. We're not going to have a vaccine for looks like until at least 2021. We don't know when therapeutic drugs will be available to minimize the danger. We know that for many people who get COVID-19, it is extremely dangerous. So many people lost their lives. So many people's lives have been changed forever as a result of COVID-19. So we've got to take this very, very seriously and follow public health recommendations. We know that we have to reopen. We understand that. Our children need to be educated. We need to be able to buy the products that we need. We can't do that all online. So we recognize that. But we have to reopen in a way that public health officials say makes sense. And the first order of business is to get the virus under control. And as we speak, the virus is still not under control in the state of Maryland and throughout most of this country. The number of new cases are still at a very high level. So we can't reopen to the full extent with the virus still having a large number of communal spreading of the disease. Once we get it under control, then we can reopen in a way that you use public health recommendations on distancing and face coverings, etc., and have adequate enough testing so that we know who's infected and trace those that are affected in order to stop the communal spread of the disease. That's when it's safe to reopen. The public health officials will tell us when that is. I think we're right to do it in phases, but I would just urge people to be patient. We don't want to see a new wave of COVID-19.
Right. You've done a great job with it. So just on a personal level, I have to ask you too, because you were the youngest elected official in the House of Delegates from Maryland, correct?
Yes, I started when I was a law student, elected to the Maryland General Assembly, and then rose to be the Speaker of the House, which was a great position at a relatively young age. So I think I was the youngest speaker in the state's history, but it was a different time. And at the time, there was an opportunity to run for the state legislature. I took advantage of it when I was a second-year student at University of Maryland Law School.
Oh, you're at University of Maryland. That's my alma mater. We love it. And you got some great schools in the state of Maryland. And, Johns Hopkins, in fact, I remember seeing you at Johns Hopkins a couple of years ago when we were, in fact, at that time, it was the Zika. It was the whole Zika, if you remember.
Certainly.
Yes, and so we've had some interesting roads.
But Johns Hopkins is doing an incredible job for our country and the world on COVID-19. Their numbers on the virus are the most reliable numbers. They've been the leader on developing testing. University of Maryland has been the leader on dealing with the vaccine and dealing with other issues. So we can be very proud. NIH, of course, is the world-class research institution. We can be very proud of Maryland's institutions on dealing with COVID-19.
No, and on that very positive note, we're going to have to say goodbye, but it's been great. Senator, thank you. Thank you for all you do. And we look forward to hearing more.
Well, it's been enjoyable. I thank you for this opportunity to talk about issues that I think are important to the people of our state. Stay well.
And our country. Thank you.